Welcome, everybody. So we're going to go ahead and get started. My name is Jennifer Ward. I'll start by just introducing the webinar, giving you some background on where we're coming from, and then I will turn it over to our wonderful presenters today, Valerie Smith and Lisa Latten, to share some fantastic resources with us in New York State. Okay, so you can move to the next slide. Thank you. Okay, so the project that we are presenting this webinar through is called the IFACT project, Improving Family-Centeredness Together. The webinar series is part of the New York State Systemic Improvement Plan, which is aimed to improve family-centeredness in early intervention. So through the Department of Health. Next slide, please. And we're coming to you today from the Strong Center for Developmental Disabilities. We are a University Center of Excellence in Developmental Disabilities. Our goal is to promote independence, productivity, and integration and inclusion for all people with disabilities of all ages. We have a number of interdisciplinary collaborative programs which focus on 4 different focus areas, ranging from health disparities, employment, education, and recreation and leisure. And we'll talk a little bit more about what it means to be a UCED and the other UCEDs in New York State as well. We'll talk about that today. Next slide. So there are 3 New York UCEDs, and we're one of them. We're at the University of Rochester. There are 2 other ones, the Rose F. Kennedy Center, Montefiore Medical Center, which is the Einstein UCED, and there's also one down in more of this city area as well, which is the Westchester Institute for Human Development, and that is through New York Medical College. And I'm going to let Val talk about these 3 a little bit more.
Perfect. Welcome, everybody. I'm so happy to be here. My name is Valerie Smith. I'm with the University of Rochester.
Unmuted, but the sound isn't connected. Oh, wait. You know what? My sound was wrong. Go ahead.
Okay. Thanks, Jen. Let me know if there's any other difficulties on my end, too. It's great to be here alongside with my colleagues with Jennifer and Lisa today. I'm with the Strong Center for Developmental Disabilities at the University of Rochester. And as Jen mentioned, we'll go over a bunch of different resources today across the entire New York State. So even though we're housed in Rochester, we will be sharing some great services across the whole state. Let me advance here. We'll start with a few programs that we are involved in through our University Center for Excellence in Developmental Disabilities. So the first one that I'll share about is called our State Regional Centers for Autism Spectrum Disorder. Here in Rochester, we're part of the Rochester Regional Center for Autism Spectrum Disorder. But what these are is a partnership of 7 different university-affiliated programs across the state. And our main goal is to provide community education and technical assistance to increase knowledge of autism and available resources for families. So really striving to enhance community resources through activities and product development. So a few of these activities that we offer are information and referral. So folks can call us with questions about autism or related disabilities, and we'll refer you to certain services in your area or your county. We offer free programs like webinar series on different topics that we hear from our community and within needs assessments. Also information sheets on certain topics like sleep and autism or feeding and autism. Free community presentations and events like our annual Skirball Family Autism Conference. Also some parent, guardian, and professional development programs for school teams. And even a Project ECHO for educators. ECHO stands for Extension for Community Healthcare Outcomes. And that's a great model to work with our community and learn from one another and our peers. To kind of show you where all of these 7 university centers are located, here's a map of our state. And the ones in Rochester are those blue counties, but we'll go over the whole state. So the University at Albany, that's the pink large section of the state. That's out of SUNY Albany. So they serve as our headquarters for the statewide network. And the different partners are our Blue University of Rochester Medical Center ones, University of Buffalo / the Summit Center in Buffalo. Those are the yellow ones to the far left in the west. We also have the college at Old Westbury, which is in green, down in Suffolk and Nassau counties. SUNY Plattsburgh is way up north, those 3 purple counties. Binghamton University is the orange, kind of right there in the south of the Finger Lakes. And then New York University is the gray with the 5 boroughs of the city. So this regional model approach allows for resources to now be available to families and professionals in areas of the state that have not had access to cost-effective services in the past. So each of these 7 centers provide high-quality autism resources to individuals and families affected by autism and to school personnel and community providers. Here's a snippet of our family library on our university website, but each of the 7 centers have something similar. So examples of these resources are online training videos, information sheets, and even archived webinar recordings and slides, and these are all free to access. So we'll make sure you have these links too following today's webinar. Another resource available across the state is our Community Consultation Program, or CCP for short. This is a team of licensed behavior analysts, psychologists, educators, and behavior specialists. And the whole approach of the program is based on the principles of applied behavior analysis. So our goal is to build capacity in settings serving individuals with disabilities, promote inclusive practices in our community and educational settings, and increase positive social, behavioral, and academic skills of our individuals served, mainly to ensure individuals receive the proper services to maximize independence. So you'll see here, there's a few different approaches we could take. A more systems level consultation approach, or maybe some one-on-one with student and families, or within the classroom, supporting curriculum, functional behavioral assessments, behavior intervention plans, and things like that in the classroom, as well as teleconsultation. Especially right now in 2020, we've been able to provide consultation virtually through Zoom, and really enjoy partnering with teams that serve students with intellectual and developmental disabilities. Next, I'm going to pass it on to my colleague, Lisa. Lisa, let me know when you want me to advance the slides, and I will do that for us.
Great, thank you, Val. Can everyone hear me? If you can't, just put it in the chat box and Jen will try to troubleshoot for you. I'm really thrilled to be here with Jen and Valerie. And my role is I work within developmental and behavior pediatrics. I specifically work with families through the intake process and then help guide them through systems upon diagnosis. And for most of you, you understand that that sounds easy, but it's actually a very complex system to help families to understand the medical piece and the educational piece and how all of that comes together. So the first thing I wanted to talk about was the clinical programs that we offer within our division. Our division is broken down into various clinics. So we have our diagnostic clinic, which is the Levine Autism Clinic. And some of you may know that as the former Kirsch Center. And that has since changed, and now Kirsch is our motor development program. So the diagnostic clinic handles evaluations for children suspected of having a developmental disability and identify what the disability is, and then make recommendations and provide follow-up care. The Kirsch Motor Development Program provides evaluation and treatment recommendations for children with cerebral palsy and other physical disabilities. We work very closely with primary care providers to prevent and treat other health-related and behavior challenges that are associated. And our team collaborates with pediatric orthopedics, physical therapy, and urology and OT. So when the children come in to the Kirsch Motor Development Program for their appointment, instead of just seeing one provider, it's a team approach. So within that hour appointment, they might see 2, 3, even 4 different providers to get the holistic approach to that. We also offer an infant toddler program, which addresses the developmental needs of children. They're typically children that we follow from the NICU up until they are 2 years old. and the clinicians are checking to see how they're growing and developing and helping to troubleshoot any problems that are arising. There's also prenatal consults that are available for families who require that support as well. Next slide, please. Within developmental and behavior pediatrics, we're really fortunate to have a variety of programs to address feeding, behavior, and then the crisis intervention services. So the first thing that we offer that I want to talk about is the feeding disorders program. And that is staffed by a feeding psychologist and a dietitian, along with a speech therapist, and looking at nutrition, eating in an age-appropriate manner, taking medicine, how does that look, helping families to troubleshoot when they're encountering problems with that. A lot of the children that we see within the feeding clinic have very restrictive diets. So the bulk of the therapy is focused on increasing what the children will eat. And our team has had great results with that. My child included has gone through that clinic. So it's wonderful. So the behavior intervention for families, or the acronym, because you know within the medical system and education system, we love our acronyms. So that is called BIF, and that is a behavior treatment program. And what that seeks to do is look at what behaviors are occurring in home and at school and come up with plans to circumvent that behavior, figure out why it's happening, and then put a plan in place so that the family structure is not as impacted as they are when they first come to us. Crisis intervention services provide the short-term community-based support for children and adults. It's supported by OPWDD, and depending on where you are, your county manages that, and they provide temporary support for families in crisis. All these programs are offered through developmental and behavior pediatrics, and the use that are currently being provided virtually through the telehealth model and teleconsult that Val was just speaking about. So the New York State Crisis Services, we have Mobile Crisis, New York Start, and we put the links up there so that you can click on those when you have. And I believe, Val, will these be shared with all the participants, the PowerPoint? Is she muted? Maybe Jen knows. I think we're going to share these slides.
There we go. Yes, we will make sure to share all the slides in a PDF format, so folks will have every link in one place so that you can access all of these.
Perfect.
Thanks.
Okay, and then something that Val and I talked about when we were prepping for this was the crisis intervention by county, since that looks very different depending on where you are. So we put that link in there as well through the Office of Mental Health, so that those of you that need additional information on that will have that link to then find out more in your area. Okay, next slide. The Families Moving Forward program is a program that is run through the Mount Hope Family Center, which is part of the University of Rochester. And this works to improve the lives of children and families who have experienced violence, abuse, or trauma. The team of psychologists and researchers, clinicians, and families work together to put in place a positive parenting program designed for children with fetal alcohol syndrome from ages 3 to 12 years old. This is currently available to families in the Rochester and Buffalo regions. I included this link so that you can just get some more information about that. And right now, I will tell you that we are, now that school has started back up, we're seeing much more of an uptick with families that are coming for suspected fetal alcohol diagnosis. And all of these programs, again, take place at our location at 200 East River Road, but we are doing some of these appointments via telehealth, even the diagnostics. Next slide. And this is our resource directory, Valerie alluded to before, that We try to refer families to this because oftentimes during appointments, there can be such a vast amount of information that we're giving families, and that sometimes you just can't take all of that in. So we have put this on our website. So if you go to our website, which is in red, all of these resources by condition and resources by topic, if you click on them, are given to families. And sometimes that's easier to give families the link than trying to talk with them about, trying to encapsulate, this is cerebral palsy. Here are all these resources, because oftentimes families are a little bit overwhelmed with those initial diagnostic and the first follow-up appointments. So this is a nice way to refer them for more information.
Perfect. Thanks, Lisa. Next, folks, I'll share a little bit about the other 2 university centers for developmental disabilities in our state of New York. So there are actually 67 UCEDs, or these University Centers of Excellence in Developmental Disabilities, across the country. But we are privileged here in New York to have 3. So the first one that Jen introduced is our Rochester one out of the University of Rochester. The next one I'd like to share with you is our Rose F. Kennedy Center out of in the Bronx. So this is another state, you said, that provides a wide variety of premier diagnostic and therapeutic services to children and adults. This center focuses on community outreach and professional training to improve the quality of life of persons with developmental and intellectual disabilities and their families. So their website here also includes an extensive list of early intervention resources specifically that we are excited to share with you, including things like newsletters, articles, and recorded lectures for free. And they can be accessed by following that link in red. The third university center is out of Westchester County as part of the Westchester Institute for Human Development. So the Institute addresses the needs of our communities through professional and education programs, technical assistance, research, and dissemination of information, very similar to the other 2. They provide health and human services to children and adults as well. And the Institute promotes changes in public policy and service delivery through its relationships with state and national agencies. So as a University Center for Excellence in Developmental Disabilities, Westchester Institute leverages this expertise to achieve high levels of social impact. So you'll see here a few of their interdisciplinary services and programs across the lifespan and across disability. Perfect. And Lisa, I'll invite you to share a little bit about Parent to Parent of New York State. Once you're unmuted, I know it can be a little.
Yeah, give me 1 second to unmute Lisa.
No problem.
Okay.
I know. Thank you, Jen. I know I'm here clicking the button like, oh my God, it's not working. Okay, so Parent to Parent is a wonderful organization, and this is broken down by state. And what this program seeks to do is build a supportive network for families to reduce the isolation and really empower families with other knowledge of people who have been through this. So you can see by the map that the Parent to Parent of New York State is broken down by regions. So Rochester is in the orange. And then of course we have North Central, North Country, the Albany area, and really looking to put newly diagnosed families in contact with parents who have gone through this and can advise them. Oftentimes this is what I would like to think of as capacity building and teaching advocacy skills to parents who are, this is all very new for them. And they have, a lot of questions and just really aren't sure where to go. And it's to hopefully set them up in kind of like a buddy system in essence to support families going through this. Oftentimes we find that families are really the best resource and really know the answers to a lot of these questions that families have early on. And Parent to Parent is a wonderful way to start to help build support systems for families that can feel very isolated And you can feel very isolated regardless if you're in an urban area or maybe it's more rural. It's still finding somebody who has a child with a disability that you can talk to about some of the challenges and also, you know, what's been successful in your home with your child.
Yeah.
Next slide.
Thanks, Lisa. Parent to parent, I have found helpful in so many ways. Their extensive listserv and everything with resources and events going on, and all mostly free. So that is a favorite of ours to share with families. Next, I'll go over something, and I recognize there's a lot of text on this slide, so we'll break it down. But the New York State Education Department, Office of Special Education, that's OSE, has created a new network of support focused on enhancing services and supports for students with disabilities ages birth to 21, called the OSE Educational Partnership, or the Office of Special Education Educational Partnership. So within this partnership, there are 14 early childhood family and community engagement centers. For short, we call them FACE centers. And also 14 school-aged FACE centers. So you have early childhood and school age. And these are distributed regionally across New York State. So the early childhood and school age, both of these FACE centers are designed to support parents and families. And each one is staffed with a professional development specialist and a resource referral specialist. So you'll see we have 14 of each of those. So a little bit about this partnership's umbrella, and then on the next slide, we'll kind of break it down so you can see the different levels of resources. But this partnership is a coordinated and cohesive network of support focused on enhancing services and supports for students with disabilities, from early childhood and school age education to engagement in post-school opportunities. So all the way to adulthood, talking about employment. The partnership aims to increase organizational capacity using this intensive team approach to technical assistance and professional development that is implemented with consistency across New York State, including New York City. So there's also something called our Technical Assistance Partnership, or the TAP, and there are 5 of these. So these partnerships provide professional development to regional teams and develop materials for various stakeholders. So it's a funded contract located within an institute, and we'll go over some examples of these, of higher education that serves 2 primary purposes. The first is to provide tools and resources for families and professionals, as well as provide direct support to the professionals within this whole OSE educational partnership. So there are 5 TAPs, or Technical Assistance Partnership. They're data, transition, behavior, academics, and equity. And then there are 12 regional partnership centers. So these regional teams provide direct training and support to families. Approved preschool and school age programs, public schools, districts, community partners. So on this slide, this kind of helps, I'm a visual learner too, so this helps me kind of break it down in an infographic showing this partnership. So overall, we have our Office of Special Education, and then you'll see those 5 TAPs: academics, behavior, equity, transition, and data. And then our regional level teams, the folks on the ground supporting families. And then lastly, educational organizations like districts, schools, preschools, and even non-districts, other childhood centers. And this is just a system, like a pyramid approach to really support families in their area with resources that are relevant to their specific place in the state. So we're going to dive a little bit deeper, and we'll start with our parent training and information resource centers. So these are, well, basically, we'll start with some background. The Individuals with Disabilities Education Act, or IDEA, provides money for each state to have at least one of these. And the main goal of these centers are to help families of kids from birth to age 22 who have a disability. So by giving parents or guardians support and free information on how to make the most of their child's education. So a few here in our state, Starbridge, located in Rochester, serves statewide, except for the 5 boroughs of New York City and Long Island. The New York City centers serve all 5 boroughs, so that's include New York City. We also have the Long Island Advocacy Center to serve Nassau and Suffolk counties. Let's see, yep, the metropolitan one is New York City, and Advocates for Children of New York is also in New York City. So a few different options there of support groups, educational specialists. These are trained providers that you can call for information and referral. So in addition to those centers, some states, and luckily here in New York included, we also have something called our community parent resource centers. So these are places that you can visit in person, or you can call and email and talk to a person where someone can answer your questions, give you advice, whether it's education or even towards employment, post school activities. These centers have a list of tutors, educational specialists, and special programs or schools. So many of these centers actually have physical large libraries of helpful books, videos, pamphlets, and online resources, which would be really helpful. And this information is available at no cost. So some centers actually send out regular newsletters too, which is nice to kind of stay up to date, especially when we're talking a lot of almost like any updates or things coming down from the government or schools, and it's like, okay, the IDEA said what, you know, and it helps break it down into digestible content for us. A few here in New York, we have our Community Inclusion and Development Alliance. That serves Queens and Long Island. Include New York City serves Northern Manhattan and South Bronx. Parent Network of Western New York serves a few counties here in Western and Central, including Erie, Niagara, Orleans, Wyoming, Genesee, Chautauqua, Cattaraugus, and Allegheny. That's Parent Network of Western New York. And then United We Stand of New York serves Brooklyn and Queens. Okay, Lisa, I'm gonna turn it back to you to talk about the ARC and BOCES.
Great. Okay, thank you, Val. So the ARCs of New York there's 52 chapters, and this is a family-led organization that also does advocacy and provides support and services to people with intellectual development and other disabilities. The 52 chapters across New York State support more than 60,000 individuals, employs 30,000 people, and has a membership of more than 100,000. The ARC provides programs and services, oftentimes providing programs that maybe if they're in a rural area that they don't have access to beyond school. So these are really integral for families looking for programs and for independence type for their child or young adult. They offer a variety of trust services to give people with disabilities the opportunity to remain in their communities with greater comfort and independence, and also providing the peace of mind to their family and loved ones that these supports are in place and that they are safe. Next slide. So the BOCES of New York State, there are 37 BOCES in the state, and there are also 12 regional information centers, I think Val alluded to on the other slide. So the BOCES really did not come into existence until 1948 when the New York State legislature created these boards of cooperative educational services to provide shared educational programs. There are a variety of things that BOCES can offer to families. They're created when 2 or more school districts have similar needs. So many BOCES are offering instructional, but they're not limited to career and technical programs, pre-vocational programs. Students with and without disabilities attend BOCES programs. There's also literacy programs and employment training for adults, regional summer schools, professional development, and also BOCES tend to handle instructional technologies for school districts, and that is really important as well. And so just real quick about the regional information centers, the RICs, they're organized under BOCES as well, and a RIC usually serves several BOCES within that region. Next slide.
Perfect, thanks, Lisa. Next, we'll talk a little bit about some inclusive recreation and leisure initiatives or opportunities across the state. First, we'll start with an organization called Rochester Accessible Adventures. And even though it has Rochester specific in the name, this team also supports across the state. So this team transforms recreation businesses to ensure individuals with disabilities are able to access inclusive, active recreation and sports opportunities. It trains businesses to offer their services to everyone, including individuals with a variety of disabilities, so physical, intellectual, developmental. One of my favorite examples of we're seeing this in Rochester is with a boat center on our canal. So working with the team to train them not only on the physical use of accessible kayaks and bikes, but really talking about inclusion as our main goal and mentality. So it's been really great to see this expanded because we know recreation and leisure is such an important part of everybody's life. The importance to choose what you want to do, when you want to do it, and who you want to do it with. So the mission of the second one on here, our Inclusive Recreation Resource Center, this is out of SUNY Cortland, and it's a really neat database where folks can visit it, here's the link, and to see inclusive recreation opportunities in your area. So they promote and sustain participation by people of all abilities, again, in inclusive rec activities and resources. So this center has an extensive online database. It includes descriptive information on how inclusive and accessible a program or activity is based on their assessment using an inclusivity tool. And the database is searchable and it may help people with disabilities and their families better plan their recreation or activities. For more information on inclusive recreation too, on our Strong Center for Developmental Disabilities website, we have a video campaign too that one video is geared towards businesses about the importance of inclusion in these activities, and one is to support families and advocating for accessible and inclusive rec opportunities. A few other statewide ideas to explore is our faith and spiritual communities, some youth programs like WISE, Scouting, our library systems. So just some ideas to keep in mind that these are opportunities that can always grow to be more inclusive. And we can work together as businesses, organizations, and families to make that happen. So we do have some time for questions. I think we might have some in the chat already. And thank you, Jen. She just put in the chat too. There's a link to an evaluation survey. This will also be emailed out to you, but Lisa and I would greatly appreciate your feedback on today's presentation. We know that this was a lot of content, so we will make sure that you get this and that you can refer to it as things come up as you're working with families. And then this is also our contact information. So both of our emails, that's an underscore too in between our first and last names. Sometimes it doesn't show up when it's hyperlinked, but we invite you to email us and contact us if you have certain questions. Lisa, I know as part of our clinic team too, Lisa meets with a lot of families and supports folks in the Southern Tier as well. So if you're joining and today's call from the Southern Tier and have questions about some resources down there in a more rural area, Lisa would be your go-to girl for that too.
Yeah, and Val and I speak for both of us when we say like we are happy to get emails and answer questions, because oftentimes when we do presentations like this, there's so much information that sometimes you feel like I can't remember what I need to ask, but there's just so much. So if you find you're going through this, next week or next month, really feel free to reach out. And if you have a particular individual that you're supporting and you just want to troubleshoot, we're happy to do that with you as well.
Absolutely. And we know that, I mean, again, it's often overwhelming hearing about so many resources that we have, and sometimes families don't know what they need until they need it. So to have places like the parent centers or community partnership centers that you can call and just ask questions, it's great to know that we have folks across the state who are ready and eager to help you understand anything from the start of a diagnosis, even to like what to expect in a diagnostic evaluation. I was referred to this. What do we even expect to when we go in? And there are resources and people. So
I have a question. Can you
yes,
hear me?
please.
Can you hear me? Oh, the question that I have is, I saw the word crisis in the presentation, and I was wondering, like, if you can give me an example of what a crisis would be that we can find out more about and all that, you know, with your resources and
Okay.
what's a family crisis that could come up that we may want to have more information about?
Okay, that's a great question, Val. I'll just jump in first and then you can add anything.
Sure.
So that's a great question. So oftentimes our families that utilize the crisis intervention, oftentimes there's behaviors at home that make it so that the child and the family are not safe, and they really need somebody to come help support and intervene with that so that the child can be at home and be safe. So we have the professionals go out into the home, and these are typically BCBAs along with our psychologist, and help to come up with a plan so that the child and the family can stay safe and they can avoid a trip to the emergency department or out of placement or out of the home placement. So that's the initial calls typically.
Thank you. Thank you.
Yes, great question. Dale, did you want to add anything?
No, I think you nailed it. A lot of the you know, situations that we see are either like self-injurious behavior in the home for, you know, for a person with a disability. So like Lisa said, we want to avoid, especially right now, any urgent care or ED. So if it's something that we can support in home.
Okay.
Yeah, great question.
Thank you.
You're welcome.
Thank you.
Yeah. I'm checking out the chat too. There was a great question around resources in other languages. So yes, there are ways to, I know Spanish here in Rochester too, we also see families, we offer materials in Mandarin and Arabic. I believe downstate as well, a lot of these written resources are in several different languages. And I know a lot of the different resource centers, ours included, our Family Navigator team, have Spanish speaking professionals too, to speak with families and work closely with interpreter teams. I'm just scrolling to see other questions.
Just to chime in here about like housekeeping stuff about the webinar. Again, the slides will be sent out by email, but they'll also be made available on our website. All this information will come to you via email, so just keep an eye out for that. Just be patient because we have to upload it to YouTube and then edit it and make sure it's all ready to go. And certificates of attendance will be sent out for those who complete the SurveyMonkey survey. So just go ahead and complete that survey. That will help me be able to develop the certificates, which will take a couple of weeks. So be patient for those. It's not an automated system. And make sure you check your spam folders when I do send out the email with our certificates, because sometimes they can get blocked by your networks. So those are a couple things that came through the chat. And somebody also asked about, okay, so another question that came up in here is, can folks share resources with us and then we can add them to our kind of resource list to be able to share?
I would say absolutely. My first thought goes to our Rochester Regional Center for Autism Spectrum Disorder, that family library, our clinic family library, but we also are connected to the other 3 university centers. We can send to them for any of their databases, as well as some community partners that also serve as those community and parent technical assistance centers. So yes, please, if there's information that you find on these sites are missing, please let us know so that we can help spread the word out. I also see another question too about parent to parent. Would they be willing to help out someone else who lives out of state, but they're a newly single parent? Lisa, you might know better than I do, but I would assume yes, that they are willing to help people, even if they're outside of the state, just to give resources, share some advice. It's a very helpful parent group.
The parent to parent, yes, because their fellow parents, they, you know, are willing to help and put them in touch with who they might know in the area or the state, and certainly provide them support until they can find someone within their area. No, they're not going to say, no, I'm sorry, we can't help you. Not at all.
And someone also commented, it is a national organization, so there are other states too that have a parent to parent.
So we're really fortunate. I work closely with our parent-to-parent organization here within the Rochester area, and she's just wonderful about really making sure that parents have the resources and the supports that they need, or being able to direct the parents to where those might be located. So we're super fortunate.
The other thing I wanted to add for everybody is if you have questions about resources and you're in the city or you're downstate, definitely reach out to those other two university centers for excellence. That's our job, is to work with the communities where we're residing, and so they'll definitely be wanting to help support you find the resources that you need, and connect you with referrals as well as sharing the resources that they have compiled. So these 3 USEDs across the state are an excellent resource for you. And we work with early intervention providers in our counties all over upstate and Western New York as well. So definitely feel free to reach out. Okay, it looks like there's another question in the chat about clinic. Guessing this one's for you, Lisa. The question is from Andrea. It says, are there any resources for helping parents to get ready for a visit with a developmental pediatrician?
That's a great question. And actually, I think we came up with a little one-pager about what you can expect when your child goes in for a diagnostic. Do you think we can add that to the list, Jen? Or add that to our PowerPoint?
Yeah, I can pull that from the website. I believe it's on our website downloaded. It's how to prepare for an evaluation. So that's a great question, and we have that resource developed.
What a smart group of people on here today.
The links are all going to be in the slides. So the PDF that I'll send out will have all the links. I'm not going to send them separately. I know a number of people requested specific links. It's just too difficult to send people separate links, the 245 people in this webinar, as well as people who will be watching the recording. So instead, the slides will be made available, and all the links are going to be in the slides that will be clickable for you. So you'll have them all in one space.
And that's really helpful. I know when I am scheduling families for their first diagnostic visit, some families will say, what's that visit going to look like? And I go through that with them on the phone or send them the PDF of what they can expect. So really helpful.
Any other questions for our presenters? Let's see. Just going through the chat to make sure we didn't miss anything. There's a couple more questions. Do you refer to other agencies for diagnostics?
That's a great question, Ursula. So even though we're in Rochester, we typically handle diagnostics from Buffalo and all of the southern tier down to the Pennsylvania border. When we get a family that's calling from, well, we also see a lot of families from the North Country, just because that's easier for them to come here than it is to go to the city. But Albany and the city tend to do diagnostics there, and we tend to handle the rest of the state. That's about the best question.
When we can't address it, or it's a location specific challenge, we'll definitely refer. One of the biggest intakes we get is adults looking for diagnostics, and we don't provide adult diagnoses.
Correct.
We're always referring to different private practitioners, as well as other local clinics that do offer it. And if somebody is specifically looking for multiple options, we do know what they are. So yes, that's kind of what we cover.
We do have too, I'm just gonna add that in those regional center databases too, as well as probably the parent and community centers, the groups that provide information and referral. So it wouldn't be just autism specific if it's going through the regional center for autism, but if you're looking for like a dentist that is experienced in inclusivity and mental health services, we have a database of psychologists, psychiatrists. Any of those questions, even though we are housed in pediatrics too at the University of Rochester, Our university center serves individuals across the lifespan and across disabilities. So we really make it a priority to be connected with our local private practices too and other resources.
I'm posting an email address in the chat box. I'll also, this is also available in the PowerPoint, but the regional center, which Val was just referring to, is in, around Rochester. But if you're not in the area around Rochester, we'll also connect you with the regional center in your area. But that is a great source for information and referral if you don't want to specifically go through one clinic, or you don't really know what you're looking for, or a family is looking for, then this is the email address you could reach out to in terms of referral. So I'm just going to post this in the chat box. Someone asked about CEUs. I believe all these webinars are 1 credit, but I am not the person to talk to about CEUs. I will redirect you to DOH, so just keep that in mind. If you reach out about CEUs, I won't have a good answer for you, but I'll send you over to Department of Health and they'll be able to answer that question for you. I believe it's 1 credit for the hours that you'll be receiving for this series. And the certificates is I'll send you the certificate, and that's what you can use to receive CEUs through the DOH. Yeah, so Denise says BI says 1 credit for 1 hour. Yep, I believe they're all 1 credit. Okay, I'm sending the survey again. I think it's available 3 times in the chat. So if you can't find it, just scroll up and it'll be there. Another question. The name of a good developmental pediatrician. Rockland County. I'm not sure where that is, but Lisa or Valerie, you might have a better idea of where Rockland County is.
Yeah, we consider it downstate from up here in Rochester. That's a great point though, Sandra, is, we know families share things through word of mouth so often, and being asked like, where can we find a good provider of some sort? We could certainly assist you with, like you said, you look them up but don't know much about them. We don't know much about them either, especially if they're outside of our immediate region, but we can connect with that other university center or regional center, and kind of hear a little bit about their recommendations. I've done that before for providers in Binghamton, reaching out to a contact there and say, hey, is there someone you'd recommend for this family? So we'd be happy to do that. If we can connect to, feel free to send me an email and we can connect you with someone in your county in Rockland and see if there's someone they'd recommend.
I'll also add that I know in our region, we have like a Region 1 family support Facebook group, and that's an excellent place for families to go asking questions exactly like that. And within minutes, they'll have responses of tons of different parents chiming in, saying that they loved a certain pediatrician that was in this practice, or they weren't a big fan of another one. And so that's an excellent source for parents, is like a family group, a regional based Facebook group, disability specific, or developmental lead for children with developmental delays, anything like that. There should be one in most regions. And I imagine downstate they have more options than we even do up here because the population is larger. So that's definitely where I would tell families to get the most, where they're going to find the most other shared family experience in groups like that, especially during COVID when the physical parent support groups aren't necessarily happening. But parent to parent is another space where those types of interactions and conversations can be helpful to connect families.
Ursula, you had another great question too about how we connect with school districts and offer our services. So we do this a few different ways. I know for our team in Rochester, we have a listserv, and we have very close partners with directors of special education, CSE chairs, and we make sure to give them updates on research opportunities, but also offer our consultation services through our consultation program. So if they're working with a student who could benefit from a functional behavior assessment, one of our BCBAs can go into the school conduct that, offer some suggestions through a behavior plan, and really work with the team, not just kind of go in, do the work and leave, but our main goal is to work ourselves out of a job where we build capacity that the school team themselves they have the tools and the resources to conduct these things and support students to the most inclusive way possible. So we just try to stay in close contact with those school teams, especially through our different programs like the Regional Center for Autism.
Thank you, Val. Any other questions before we wrap up for today?
I must say it was such a pleasure being with everybody too. Thank you, Jen, for inviting Lisa and I.
Yeah, it was wonderful. Good way to spend my lunch.
Yeah. In this beautiful fall day. I hope everyone across the state is having some sunshine like we are here.
I know.
Okay, I don't see any other questions, so we'll go ahead and wrap up the presentation. A big thank you to our fantastic presenters. And yes, we'll be sending out the slides so you will have all these resources available to you. They're also going to be posted on our website so that you can share the web link, which will have all the webinars, all the webinar slides, and all the webinar evaluations, so you can watch them at another time if you were unable to join one live. Thank you everybody for being here, and thank you to our presenters, and I hope you all have a wonderful rest of your week.